inflammation in reality is a necessary and life-saving thing. It's part of what we call the immune system, and it signals for that to continue to defend us from things. The immune system, however, can go overboard sometimes, and this is especially so when it comes to fluid. Fluid is most definitely for protection, especially after an injury, but it's not perfect. It actually only works to a point. What we want to do is actually get rid of some of that excess fluid. We want to alleviate the fluid pressure on the body or that part that's injured if it is in excess. And to do that, we have the use of the lymphatics. Lymphatics are an interesting thing because certainly they have their own capacity for fluid removal, but at the same time, the use of body movement, whether that's changing fascial tension or muscles, this can actually assist lymphatic fluid excess, fluid caused by inflammation, to be drained off. It's not all of it. Movement of the body is not all of lymphatic drainage, but it is part of it. So if you want it optimal, that's how we do that. However, lack of movement can make it suboptimal, can make it less effective. And this is especially so, you'll find, when we are generally not moving well leading up to our injury, or we maybe have a poor diet that doesn't help us with that process. It turns out, too, when we have a traumatic injury paired with excess fluid, paired with lack of motion, we may actually create permanent changes to the tissue, permanently lacking the motion. This is why physiotherapeutic exercise, or really any exercise recovery after a traumatic injury, in addition to maybe manual therapy, working on the body, why it's so important. And when we do consider this, when we want to make a big change, we have to consider the entire body, because that is how the lymphatic system works. That's how the drainage happens from one point to another, from the very small to the very big. We have to get it all working, or we have a lot more trouble working on the smaller parts. So how do we do that? Let's say we have an injury, we injure our ankle. We get that whole inversion sprain, which is so common. And it turns out that the tissue on the side, the lateral side or the outside of the ankle, that's where it tends to hurt. I could do better than that. Lightning bolts there. Pain shooting out of there. Of course, we've probably all had this to some extent. It tends to be this area swells up with fluid, as it should. This is good. Fluid is an immobilizer because it doesn't want you injuring the tissue further. It doesn't want you to keep inverting that ankle and keep moving. That being said, we have to constantly clear that fluid. There is a cycle of fluid going through, and some of it will be contained in the space for a period of time. But eventually what we want to do is we have to get it out, and it has to go quite a ways up to do that. These are, the deeper lymphatic pathways coming through. Eventually it's all headed. It's going to do this. It's going to head back to the heart. For those of you that know, it'll go through the vena cava to get there. That'll look superior vena cava coming through like that into the heart, but it has to actually travel a pathway to get there. So to get this, just understand that to get this effectively drained of that excess fluid, has to make it all the way up the body. And again, there is muscle within that lymphatic tube system. There are valves to encourage in the right direction. But the tissue surrounding that lymphatic structure, we could easily, mention the quadriceps. There's going to be superficial tissues that are powered by everything. This is one pathway I've drawn in here, but anything that's in and around that lymphatic system, that tube system, is going to be putting pressure on it. The fascial system is comparable to, I'm not going to keep this here, but there is a system of connective tissue called the fascia that runs around all these things. And with changing fascial tension, it helps to push it through. It helps to keep it moving. So we want to get it back. So that means, in a really, really simple way, if we're lacking motion at these different points. If we can't move here and we can't move the hip, let's say, can't move the low back, we're going to have a lot of trouble moving it through effectively, quickly, within a reasonable amount of time. So we need to make sure all those points move and all those points are relatively supple as it goes. So that's knee motion, flexion and extension, for instance, all the circumductory motions of the hip, every direction there, pelvis sacrum motion, low back motion, flexion, extension. And this means that working in an isolated area, though it can be easier because you can do a shorter treatment process, you can do less work, less exercise, working in an isolated way, yes, that's faster, but working on the whole body will have a much better effect. And I think probably the people who work in the exercise therapy field, they will feel that I have enough trouble getting any one person to do an exercise, So adding a few more, well, yeah, good luck with that. I agree. In any case, we'll try. So when it comes to the hand or the elbow, for instance, just to make another example, say we've hurt our elbow, we've sprained something right here. We got another couple of lightning bolts shooting off this elbow. The pathway that fluid has to take back runs to the same area. It wants to run to the same area. It's going to go underneath the clavicle because we're on the right side. It'll go through the right lymphatic ducts. It too will eventually empty into that vena cava to go back to the heart, back to the main circulation, to be part of the blood again. And so if we've injured that elbow, we've got to ensure that everything leading back to the heart is moving and working well, and the tissue is relatively supple. So it could be the biceps. Here, there's going to be, of course, circulation of the lymphatics on the back side to the posterior side through triceps. You could throw in, coracobrachialis if you want, even the pecs to some extent, the position of the clavicle and the scapula. These are all important things. And understand, of course, that it won't recover things instantly if you have great lymphatic motion in your body, but it will make the best